The term Mowgli syndrome is not a recognized medical or psychological diagnosis. However, it is sometimes used colloquially to describe a rare phenomenon where a child exhibits behaviors similar to that of an animal, particularly a dog. When a child displays dog-like behavior, it is often attributed to various underlying factors, such as psychological, developmental, or environmental issues. Some potential explanations could include developmental or psychological disorders. Certain disorders, such as autism spectrum disorder or other developmental delays, may result in unusual behaviors and difficulties with social interaction. These conditions can manifest in various ways, including imitating animal behavior. Environmental factors. A child's environment and upbringing can influence their behavior. If a child is exposed to an environment where they observe or interact more with animals than humans, they may mimic animal behaviors as a form of imitation or as a way to cope with their surroundings. Emotional or psychological trauma. Experiencing trauma, neglect, or abuse during early childhood can have profound effects on a child's development and behavior. In some cases, a child may adopt animal-like behaviors as a response to the trauma they have endured. It's important to note that without further information or a specific case study, it is challenging to provide a precise explanation for a child exhibiting dog-like behaviors. Each situation is unique, and it would be best to consult with medical or mental health professionals who can evaluate the child's specific circumstances and provide appropriate guidance or interventions. If you are concerned about a child displaying these behaviors, it is recommended to reach out to healthcare professionals, such as pediatricians, child psychologists, or child psychiatrists, who can conduct a comprehensive evaluation and provide appropriate support and treatment options.